Cambridge University Press dropped this article 15 hours ago, and every single healthcare provider who treats women over the age of 30 has got to read this. This article does an in-depth discussion of the psychological changes that happen due to declining and fluctuating estrogen levels, progesterone levels, and testosterone levels in perimenopause and menopause. They discuss anxiety, depression, low mood, anhedonia, irritability, insomnia, and dissociation. Estrogen has profound impacts on our brains. And when it fluctuates and declines in perimenopause and menopause, it changes the levels of our neurotransmitters in the brain. Now, it's important to note that not all women will experience this, but many will. We see worsening of pre-existing disorders and new onset of disorders in perimenopause and menopause. In Britain, the most likely time for a woman to commit suicide is between the ages of 45 and 49, and these authors believe this is directly related to perimenopause that remains untreated. For people who are being treated for their mental health disorders, you may notice that your medications no longer work in perimenopause, or you need much higher doses in order to get the same effect. This is expected to happen. Peri- and postmenopausal people do not respond as well to SSRIs. And these authors are suggesting that medication should not be first-line therapy. These authors also say that estradiol therapy has been shown to be beneficial in the treatment of perimenopausal depression as a standalone agent, but with a greater effect when combined with an antidepressant. They also talk about the correlation between severe vasomotor symptoms like hot flashes and anxiety. These authors also state that when a patient experiences a relapse of their mental illness during perimenopause, clinicians often prioritize treating the mental illness rather than their perimenopause, and they feel like this is not helpful.